listening to VIT Community Radio 90.8. Today we have a special program on the occasion of World Blood Donor Day, Your Blood, Their Tomorrow. And this is Dr. Visa. I have along with me
RJ Sai Serenia,
RJ Aarti,
and our special guest, Dr. Joy John Mamen, Professor, Transfusion Medicine and Immunohematology, CMC, Vellore. Welcome to our show, sir.
Thank you very much. It's an honor to be here today with you all.
Thank you, sir. So let's start the show. The first question, sir, can you please tell us about your role in this blood donation concept?
Okay, thank you so much for this invitation. I'm really happy to be here today and discuss this very important issue on the occasion of the World Blood Donor Day. My name is Joy Mamen. I'm a pathologist by training, and I've been working in blood transfusion services in CMC for just over 25 years now.
Okay.
I started soon after I finished my post-graduation in pathology. I joined the Department of Blood Transfusion Services here. So we have two parts to the department. One part looks after blood transfusion services. The other part looks after laboratory services for the hospital, routine lab testing of blood, which is done by our laboratory. We also do HLA typing and pre-transplant cross-matching for patients. That's also done by our department. So my main role is to work with donors and motivate people and bring them in to engage with the community for blood donation, because we think that's a very important part of our whole contribution to patient service in our city.
Okay. So one basic question, sir. When did we start this concept of blood donation, sir?
The story of blood transfusion goes back maybe 300-400 years.
Okay.
And actually what happened is in Europe, there were some experimental transfusions where people thought that all blood looks the same. So you can transfuse from animals to human beings. And so in the 1500s and 1600s, people would take blood from sheep and calves because they thought they are gentle animals and transfuse them into people. After some time, there was a major incident. People would die because of this, and there was really no regulation or any authority to decide about this. So after some time, after somebody very important in the court of France died, then this whole thing was stopped. The king banned blood transfusion for a long period of time.
Okay.
The other aspect of blood in treatment is that bloodletting was thought to be an important method of treatment. So if somebody had fever, the physician would come and do bloodletting. That means they would put an incision and allow bad blood to drain out. So they would think that if you drained out blood, the disease would leave your body. Actually, it would leave the person more sick. If it was a self-limiting disease, they would recover from it, and then everybody is happy that the treatment worked for that patient. And some people would die because of bloodletting also.
Okay.
So the real change happened after 1900 when blood groups were discovered by a person called Karl Landsteiner, whose birthday is the World Blood Donor Day that we celebrate now. That's the occasion. WHO in 1978, I think, has declared this as the International World Blood Donor Day, which is celebrated all around the world, and so many organizations recognize this day. So in his lab, he did this research of trying to find out why some blood lyses when they're used against other groups. So good fortune for him was he had people of all blood groups within his laboratory.
Okay.
Of A group, B group and O group. They all tested against each other and found this concept of blood groups.
So basically, how many blood groups are there, sir?
So commonly we talk about major blood group systems, which is this AB and O blood group system that we often talk about.
Okay.
And then there is another group called RH system. So normally when we talk about it, it's AB, O and RH that we talk about. So if I say I'm ARH positive, that's a commonly used blood group system. Apart from this, there are more than 40 blood grouping systems.
Oh.
And these are based on small antigens. We call them antigens. They are either sugars or they are some kind of polysaccharides which are present on the surface of the red cell, on the membrane, on the RBC membrane. So based on what is a configuration of that antigen, you are named as either A group or B group. If you don't have A and B antigen, you're called as O group. So something missing from A and B is called O group.
Okay.
If you have both A antigen and B antigen glucose moiety on the cell surface, then you're called AB group.
Okay. How do you designate this positive and negative, sir?
So positive and negative is based on the rhesus antigen. It's antigen again which is present on the cell surface. It is again inherited like the ABO system. It's inherited from parents. And if the RH antigen is present on the surface, it is called RH positive. Now RH positive is not like AB and O. There are more antigens in it. They're called C, D and E system. And when we say RH positive, we mean it's RHD, capital D positive. And that's what we considered as Rh positive. So Rh positive, among all the groups, we find that AB and Rh are the most important ones. So normal screening and blood grouping is done for AB and Rh.
Okay.
So that's all we do usually. Then sometimes we have patients, when we test their blood, we will find unusual antibodies.
Oh.
So that's when we test for the other groups. We call them minor groups. MNS, KEL, Duffy. There are many systems like this.
Okay.
And I think one of the ones which was discovered last year was by an Indian from the National Institute of Immunohematology in Bombay. So that was one of the latest ones to have been described by an Indian group also.
Okay, so a new group has been evolved.
It's been, discovered
Okay.
2 years back.
Okay, so now I give it to Sai and you can throw your questions.
What are the eligible criteria that should be followed before donating the blood, sir?
Yeah. So just a little bit of rewind on this. After the blood groups were discovered, people discovered that you can safely take blood and transfuse it. And they discovered that if you take blood and keep it outside for some time, it's going to clot. Yeah. So then they said we should add some anticoagulant agent to it to prevent the clotting. So it all used to be done bottles which had to be sterilized and used, and rubber tubing and needles which were taken from them. So I think a large impact came during the World Wars when they discovered that you can take plasma and you can refrigerate it and you can transport it in refrigerated ships. Okay. So in the Second World War, a lot of lives were saved because plasma was transported, and that was the actual beginnings of early blood banking practice. Before that, people would take from one person and give it to somebody else, but nobody banked it. And I think in Chicago was where the first blood bank came up, I think sometime just before the Second World War. So then things progressed. You could collect blood, you could, if you refrigerated it, you could store it for a given period of time. And then this whole concept of having people to donate blood so that others who need it when it is urgently required for loss of blood or bleeding disorders or variety of conditions, we can give blood. So now coming to your question, what makes you eligible to donate blood? Any healthy person is eligible to donate blood at a very broad sense of it. We'd like donors to be over the age of 18. And I'm speaking about Indian criteria. I should have completed 18 years. And that's because that's the age of consent in India. I should have completed 18 years to give consent to donate blood. Then we want people who are generally healthy, which means you should be more than 45 kilos at least in weight. And the hemoglobin should be more than 12.5 grams per deciliter. So there are other criteria which we will come to and we'll discuss later. But generally, if somebody is healthy and over 12.5 grams hemoglobin and more than 45 kilos weight, we encourage them to come in and donate, which means you don't have any other disease, you're not taking any other chronic medication.
So
That's the basic criteria.
how frequently a person can donate the blood, sir?
There are two major divisions in this. That's just based on sex. So males are allowed to donate 4 times in a year and women are allowed to donate 3 times in a year.
Yeah.
And that's also related to the baseline hemoglobin levels and the fact that women in this age group are also going to have menstruation and physiological blood loss. So to prevent extra stress in the system, we say that you should donate only 3 times for women. We've also found that if you're a very regular donor, that is, if you're going to give 4 times every year and 3 times every year, there is also a chance that you will deplete some iron in the body.
Okay.
So our recommendation is just donate at least 2 times in a year and keep the other for a buffer if you have to come and donate for somebody. So our volunteer donors, we really encourage to donate at least 2 times in a year and be consistent with that. 3 or 4 times if you're eligible, great. In certain countries, the age limit is different. So in US and some parts of Europe, they allow the children to donate at 16 years, but that's because their physiognomy is different, their average body weight is different, their height is different. So they're allowed to donate, but there should be parental consent in this sense, and then they can donate. And they start earlier than they start with us, and they go on later than 65 years as in India also. So if you have started donating early, you can donate till 65 years. If you've not donated, then you can't start donating at the age of 60. You should have started earlier. If you started early, you can go up to 65 years. That's the upper limit.
So there are a lot of myths regarding blood donations. Can you talk about that, sir?
Yeah. So that's always an interesting topic. Some of these myths and understandings have not changed in 25 years. When I was training, we had people who would come and be reluctant to discuss about blood donation. And it's the same stories till now. And I think it is a lack of awareness in our community, which is now increasing and changing. So for one thing, it is that people feel that this blood that you have inside your body is a finite amount. It's a set amount. And if you give up that blood, it's not going to come back again. So that is the biggest fear. If I give blood, I won't regain it. I'll become weak after this, and then there are problems related to it. The second is that there are beliefs that if you give away blood from the body, you're giving away life. So especially in some rural areas, we have this concern. So young people who want to donate say that we will come to the hospital and donate. Don't conduct the camp in the village because the elders will not like it. So those are other beliefs. There are also people who think that blood donation can make you impotent. So people say, I'm going to get married soon. Can I have children after I've donated blood? Yeah, so you're laughing now. But these are real stories that people come up. These are the common fears that people have. Yeah, myths among people that they have. We all know that blood is constantly generated in the body, and the average red cell life is about 120 days. That's good. So blood is constantly being produced, and we have emergency stores within our body itself. So an average person will have 4.5 to 5.5 liters of blood in the body.
Okay.
And some of that is circulating constantly, and some of it is actually kept in reserve in the organ called the spleen or in the liver, and some places in the bone marrow there's blood which is sequestered away. So when you donate blood, that amount of red cells is mobilized and will come back into circulation.
Okay, our own storage.
Your own backstore
Get
comes
released.
into. Correct.
Okay.
Comes into. So we encourage people to drink water and refresh themselves just to bring up the liquid volume. The blood cells will be mobilized and will come into circulation in a few hours after.
One other question. If a woman is during her menstrual cycle, is it advisable for her to donate blood?
So earlier we used to have criteria by which we said if you're having your menstruation, wait for some time before you donate. Right now we tell them immediately after menstruation you can come in and donate.
Oh.
It is only because some people feel giddy and dizzy. The chances of that are higher.
Okay, based on your health level. Okay,
So body weight, you're already feeling unwell. Yeah, some people have cramps and periods are difficult time for some children. So in the middle of that, to ask them to donate is a stressful thing. So we say just make the experience better. Just wait for the menstruation to finish and then soon after that you can donate.
Okay.
That's not a problem.
It was interesting to listen to you. So before the next questioner, we'll have a short break. You're listening to VIT Community Radio 90.8 and this is Your Blood, Their Tomorrow.
உங்கள் இல்லம் நுழைந்திடும் உங்கள் செவிகளை தீண்டிடும் உங்கள் மனதினை வருடவே பொன்பலையாய் மலருதே உங்கள் இல்லம் நுழைந்திடும் உங்கள் செவிகளை தீண்டிடும் உங்கள் மனதினை வருடவே பொன்பலையாய் மலருதே VIT 90.8 வேலூரில் நாங்கதாம்பே VIT 90.8. Ladies and gentlemen, you're listening to VIT Community Radio 90.8 FM. Engage, evolve, empower.
You're listening to VIT Community Radio 90.8. This is a special episode for the occasion of World Blood Donor Day and we have Dr. Joy Mamen amongst us. Yes, I continue your questions.
So what are the possible risks or side effects while donating the blood, sir?
While donating blood, we call them donor adverse events. So sometimes people can have adverse events. And the mildest form is when people feel giddy or feel dizziness after they donate. So some of this can be due to what we call as a vasovagal effect. When you lose a certain amount of blood, then the nervous system kicks back into play. And just to improve the circulation to the brain and heart, you feel giddy. All that we need to do is make you lie down with your feet and elevate it so that blood flow is restored to the heart and to the brain side, so then things become all right. Some people just get nervous when they see blood or just that excitement. Excitement. And so some people faint because of that. Those are the most common adverse reactions that we encounter in a system. The other things can happen due to the actual poking. Some people, when they are poked due to pain, have this kind of a reaction. They can faint. So that is another problem we can have. Sometimes a little bit of blood will ooze from that site from where we took blood, which is why we say after you donate, you have to apply pressure for at least 5 minutes to make sure that the bleeding has stopped completely before you take off your hand and we put a sticky plaster there. So that is also an important side effect. The blood leaks out and the next day it becomes dark and black and then people wonder what's happening to that particular site. Other more complicated things are like patients can have low BP because of this, because they've donated blood. There is a kind of a reflex low BP which can happen. For those people, we will start an IV and then we'll ask them to rest for some extended period of time.
Okay.
So mostly it's due to the fluid imbalance. So when you give 450 ml of blood or 350 ml of blood, then the fluid goes out from your body. We need to compensate. It's an important question because if you don't have a good experience when you come to donate blood, then the next time people are apprehensive about it and don't want to come back.
Yeah.
Donate.
Sir, if a person want to donate blood, it is said that they should not have alcohol before 24 hours. Why it's so? Sir?
So there are 2 or 3 reasons. One is that we want everybody to be healthy and in their full cognition when they come to donate blood. That's also because we take consent from them, and you should be in full control of all your senses when you're donating blood. So we don't want any risk of that. The second thing is, in some people, it will also cause dehydration. Some of alcohols can also increase diuresis, so you will pass out more urine. And then at the end of it, you do a donation which normally should have been a normal event, and then you become hypotensive or you faint, and then you have other reactions with it. But most of all, because we want just no risks for the patient who's going to receive that blood also. We do not want any residual levels of alcohol in the blood also at the end of this story, because we're going to give it to patients who are very sick. We do not know what kind of problems they have. So at the baseline, we want everybody's to be similar in quality and similar in safety as far as possible.
Even the persons with high blood pressure and diabetic should also not advise to give blood.
Yes, until about a year ago, we had this criteria that we should not donate at all.
Okay.
But now we have changed, the national guidelines have changed, and we do allow people with mild hypertension and mild diabetes to donate. But there are very specific criteria around it. And most important criteria is that you should not have changed the medicine in the last 30 days.
Okay.
Your disease should be stable. And the third criteria is you should not have any end organ damage. That means you should not have any complication because of diabetes or for hypertension.
Okay.
So sometimes hypertension can affect the kidneys, hypertension can affect the vessels of the heart, it can cause renal disease, diabetes can cause eye problems and vision problems. So if there are no complications and it's only mild disease, theoretically we can take it. Now in our community, often many of our donors who come, who are in that particular age group and have started taking medicines for diabetes, are not aware of what exactly, they might not be able to tell us, these are the medicines I'm taking. They can't name the medicines. Also, we are not particularly rigorous about making sure that we check every 6 months. I'm doing my glucose levels, I'm doing my HbA1c levels to make sure that the glucose is in control, glycemia levels are in control. So when we do not know, then we can't have 2 groups. Like one group I can ask and they can get the answer and I can take from them. The other group who do not know said, I've been taking medicines. When did you check with the doctor? Maybe more than a year ago. So then it becomes challenging in our communities to make this. But if someone can answer these questions, of course, we can take blood from them also. In people with diabetes, there's also an increased risk for infection among them.
Oh.
There are some immune-related problems with diabetes. So there is a risk of what we call a subclinical bacteremia. So if you can have infections and you might not be aware of this also. So if we take that blood, store it, and then we give it away, there is a small chance that the person who receives it can also have problems from it. So there are other risks with. In fact, recently one of our postgraduates did a thesis where we determined that people who have high blood sugar levels, as evidenced by this marker called HbA1c, glycated hemoglobin. If it's more than 5.7, we found that their red cells become more sensitive to damage. So they don't behave like normal red cells.
So it's very risky, no sir?
So it's not actually ideal to take from diabetes. And especially if it's not well-controlled diabetes, then we'll have other problems with it. Also, people with high blood pressure, the body is used to a certain baseline blood pressure for circulation. So suddenly if you take out 450 ml, some people might have hypotension for which their drugs have been taken as usual. The blood volume drops. There is some hypotension. So there are small risks associated with this. The guidelines are there to give us, some of these are regulations and we say no, but sometimes the medical officer can make a judgment and say that, especially if the donor is well informed and knows and leads a good healthy lifestyle, we can take from them.
So how long does it take to diagnose a blood, sir? Whether it's in good condition, it's affected, is it really worthy to be transfused? So what is the duration?
Okay. So when we collect blood, we have the most important part of our whole story is donor selection. So we make sure that we have even enough awareness in the community that only people who are healthy should come and donate blood. So that's the first self-selection and self-screening process. Then after that, we have a history from which we take and say that certain criteria you should not donate, certain criteria you can defer for short periods of time. They call temporary deferral. So if you have a viral fever and just finished taking Metacin yesterday, we'll say wait for 3 or 4 days before you come in and donate. And then we have permanent deferral. So if somebody has had tuberculosis or somebody has had some cardiac event, then so those kind of situations, we will say not to donate blood. Then once we collect it, we know that there are risks associated with transfusion. And some of the risks associated with the transfusion is the infectious diseases which can be transmitted, and we call it transfusion transmissible infections. So those are infections which can be transmitted through blood.
Okay.
Most commonly, everybody knows HIV.
Exactly.
It kind of came up very significantly about 30 years ago, and we all know about it. Before that, we had started testing for another disease called hepatitis B, which causes jaundice. Then hepatitis C is the other disease which we screen for, also causes liver problems. We also screen for syphilis and for malaria because all these diseases can be transmitted through blood. So these are basic diseases which WHO encourages all countries to test for. And we have national regulations for this. So this is the minimum set of diseases that we should all screen for. In certain countries where malaria is not prevalent, they won't screen for malaria. In certain countries like in US and certain parts of Europe, there is this disease called West Nile virus.
Yeah, yes, sir.
Yeah, you've heard of it. It starts in certain times of the year. So after the rain season, it starts coming up. So they test at certain times of the year, they test all their samples for West Nile virus and make sure it's negative for that. In other parts of the world, there are other diseases which can be transmitted through blood. So they will test for that also. And it is dependent upon the epidemiology and the diseases which are prevalent in that country. So for us in India, hepatitis B, C, HIV, syphilis and malaria are mandatory testing in the country.
Yeah.
So we collect blood, we do the hemoglobin testing for the donor beforehand. And then once we collect blood, we usually do a batch testing because otherwise it's not logistically convenient to take each sample and test it and do it. So we run tests 2 times a day in our system. So it takes it depends on which time of the day you donate. If you donate in the morning, it'll get into the morning batch. By 10 o'clock, 11 o'clock, we'll start testing. And by 2 or 3 in the afternoon, we'll get the results for that. And the blood is ready for issue after that. So the shortest window, I would say, is about 6 hours. And then if you donate after that test run has started, then we will run it in the next batch, which starts in the afternoon at 3 o'clock and finish by 6 or 7 in the evening. So logistically, it is challenging for us to take one single sample and do it. It is possible for us to do it. And in certain very emergent situations, we have a severely bleeding patient, we bring in emergency donors, we can run another round of testing, and it's not impossible for us to do. We do that in an emergency situation. So I say, comfortably speaking, we want that stock in the shelf, which is why we want to encourage people to come in and donate electively. Even now, I have a group of people who reach out to people who come as replacement donors, and we want to reach out to them and remind them to come back and donate as volunteers. So they'll all say, you call me when there is an emergency. Now, when there's an emergency, for me to reach out to somebody, then bring them in, have them donate, the donation process will take about 45 minutes. All the screening and test, all that. Then to test that blood and make it ready, prepare the components and take it out. It would take time. So logically, blood on the shelf is the blood which can be used in emergency. That's the adage.
How long can you save it, sir?
So blood.
Do you have any expiry date?
Yes, that's a very good question because there is a story behind that also. Recently, we've been changed from calling ourselves blood bank to blood centers.
Okay.
And that's because often people say, I donated 2 years ago, I donated 5 years ago. Why are you asking me to bring another donor now? So people treat it like the money bank, the financial bank. If I put it now, 5 years also I can take it, 10 years later also I can go to the ATM and take out the money. But blood has a shelf life. So red cells shelf life varies. It depends upon what there are additives we can add to the blood. So we store blood for 42 days now. That's the maximum which is available right now for us to store. Some blood banks, they store for 35 days and some people store for 28 days. Mostly it's now 35 days on an average. And if you add some additive to that, you can keep it up to 42 days.
42 days.
42 days. But if you freeze it, you can keep it for 10 years.
Oh.
But freezing blood is very challenging. Yeah, you need specialized equipment.
Is it happening in India, sir?
There are certain, I think the army has facilities for this. because they want to store large stores and keep it mobile. I think All India Institute of Medical Sciences has this facility. It's not cost effective for small players like us to get into it. Yeah.
So, say for example, you said 35 days or 42 days.
42 days, yeah.
42 days is over.
Yeah.
A particular packet of blood is not used.
Yeah.
So, what do you do that?
So there are uses like quality assurance. So we have to do quality control on all our blood. So some of the expired blood goes for quality control.
Okay.
But otherwise, after that, we have to dispose it. And there are standard methods for disposal of blood, which the government prescribes. We have to autoclave it and then we have to send it for deep burial. So it is discarded at the end of the shelf life if it is not used.
Okay.
It has to be discarded. We can't keep it and use it for anything else. So all products have shelf life. We talked about red blood cells or whole blood, which is 42 days. We can keep platelets for only 5 days because it has a very short shelf life. If you keep it longer than that, either it becomes non-functional or the bag can have contamination. Plasma, which is frozen at -80, can be stored for up to a year at -40 degrees. So that has the longest shelf life. So plasma is after you've centrifuged the blood, you take out only the liquid part, the straw colored part.
Yes, sir.
That can be stored for longer periods.
Can you elaborate more between the two terms, blood bank and blood center?
Yeah, we used to be all called blood bank before, but due to advocacy in the community, we have them changed to blood center because bank, like I told you earlier, the connotation is once you give, it's there forever. And this is across the country. All blood centers had this advocacy related thing, so we changed it. So a blood center is where all operations can be done, from collection, bringing in donors, collect the blood, test it, make components of it and store it and give it for patient. That's a blood center. There is another entity called blood storage unit. That is what smaller hospitals do. They don't want to run a full scale blood center. Then they can run a blood storage unit where they link up to a blood center and we'll collect the blood from there, use it for their patients over there locally. And we try to make sure that blood does not expire and gets wasted over there. We refresh their stocks periodically for them.
And a personal question, sir. Based on your experience and years of dedication to this field, what do you feel about this? Do we have the required technology and human personnel to do the required work? Do you need anything more?
So in our country, currently we have more than 4,200 blood centers across the whole country. Like we are a country which has the maximum number in the world, I think, right now. And there is a range of services people provide. The basic blood centers provide whole blood alone, and the more advanced centers like us will do more advanced testing and provide better services for people. So in our blood bank, I talked about testing. We do first level of testing, which is called serological testing. We look for antigens and antibodies. And beyond that, we also do what is called as nucleic acid testing, where we are actually trying to find the RNA or DNA of the virus, which is present in that. So with that, what happens is that the safety level is improved. An antibody might have been diagnosed, say, 2 weeks or 3 weeks after the infection, but with detecting RNA, we can bring it down to 5 days to 1 week. So what we call as the window period is reduced, and therefore blood becomes safer for people to use. We've been doing nucleic acid testing for, I think, about 10 years now. We started in 2014. So we've been doing for more than 10 years for nucleic acid testing, ensuring better safety procedures for them.
Okay.
We also have many specialized procedures that we do to blood. So we can irradiate blood, patient who have transplant, women who have babies who are in utero and require transfusion. We give irradiated blood. We can do that kind of technique.
In utero babies?
Yeah, in utero babies. Sometimes they develop anemia. They need transfusion, so we can transfuse them. It's being done in our hospital also. And then apart from this, we support our transplant services. We are running bone marrow transplant services from 1989 or 90 onwards. So that requires a lot of blood products because when you're transplanting a patient for leukemia or those kind of situations, you will ablate all the marrow. Then you will give new matched marrow for that patient. And during that time, you need transfusion support. So sometimes they will need platelets. Sometimes they will need red cells. Sometimes they will need only white cells. We can separate out white cells alone and give it to them. So all that technology exists in our blood bank. Usually all this processing is manual. Blood centers used to be very manual operations before. So now we have completely automated platforms for the serological ELISA testing. We have chemiluminescence assays. We have molecular testing, which is fully automated. All our blood grouping, typing, and cross-matching is done on fully automated platforms. We also have devices which do component separation, which is fully automated also. So we don't have to manually do these processes. You put into the machine, 20 minutes later, you get 3 components from each unit of blood. I've seen blood centers across the world from Australia to US. I think we have some of the best centers in the world-class centers as compared to the rest of the world. So in terms of technology and application of science, I don't think we are behind anybody across the world.
So great, sir. So we'll go for a short break. You're listening to VIT Community Radio 90.8 and this is Your Blood, Dear Tomorrow. Listening to VIT Community Radio 90.8. This is Your Blood, Their Tomorrow and we are having Dr. Joy Mamen with us. Yes, sir. I have a cosmetic question related to blood, sir. Recently, I saw on YouTube that whatever you apply on your skin, it directly goes to your blood. Is it so?
Not all things that we apply on our skin goes directly into the blood. You should remember that the skin is one of the first organs of defense of the body. In fact, it's the largest organ system. There you are. We have our biotech students pitching in.
Yes.
So it is a very important barrier. If everything we applied went directly inside, then we'll be in big trouble because of it. So certain chemicals can be applied to the skin and they will be absorbed. And so that's the logic of having certain types of ointments and medicines that we give for skin application. But all the things that you apply are not equally absorbed and do not go. Some of them act locally. Some of them can be absorbed and can go into the blood.
Because in today's world, people are compelled to groom themselves. Every day you are compelled to wear makeup before you go for your work. So how does this lipstick lifestyle, everything affect a women's health, sir? So, as a doctor, what do you feel about this?
And I think there is constant pressure nowadays because with internet and social media, there are all kinds of people inventing all kinds of new treatments and one is creating standards and creating problems, but also inventing new types of treatments which are not scientific, which have not been tested in the usual way that we expect cosmetics and drugs to be tested. You should remember that all cosmetics in India are regulated. All of these have to undergo testing and licensing by the drug controller before they are released. So what you see on the media may not always be true and may not always provide the results that you think that they are providing for them. And especially when it comes to products which are from human origin, so taking blood and applying it on all those things are dangerous actually. So it is best that these things are done for specific treatment purposes under supervision. You should have some medical advice before you follow those kind of advices.
Okay, so how can we find out whether this is skin safe?
So usually all these will have a license on the cover. If you look at the product insert which is there,
it mentioned animal tested or cruelty free. That's all.
So if there is a drug license attached to it, manufactured under some license and Indian Standards Institute or EFSI or one of those drug controlled organizations which are licensed, then that has to be displayed on the surface. If it's not displayed on the cover, one should just assume that it is not a licensed product.
Okay, better to avoid
not
those
gone
products.
Through the safety testing which is required.
Okay.
Sir, what are the conditions in which blood transfusion should be done, sir?
Will be done. Okay, so there are different types of conditions and it affects people of all age groups and all genders. None of us can predict when we will require blood, and that is one of the awareness stories that we want to tell people, that people always say that I will come and donate when my family, there is an emergency, then I have to donate. That's why I'm not coming and donating as a volunteer donor. All of them are saving themselves up for when their friends and family need the blood. But every day we have people who have accidents accidents on the road. And those are kind of unexpected trauma. No? Suddenly somebody has a fall, has an injury, loses blood because of no fault of their own. When they come to the hospital, they need blood transfusion. So we are situated very close to our emergency department, and we often get the request for emergency transfusion from them. We also have due to various types of diseases. So diseases like cancers, which are more commonly known, can cause loss of blood. It can either be due to suppression of the bone marrow, or it can be because the cancer itself, the bone marrow itself, and preventing normal red cells from coming up. Even chronic diseases like liver failure, kidney failure, all these diseases can cause decrease in the hemoglobin levels, and they will require transfusion. The other big group which requires transfusion are pregnant women, and sometimes it is due to severe anemia, which is becoming less and less nowadays. But we also have situations where they can have bleeding immediately before the delivery. During the time of delivery, unexpected blood loss can happen. And so those kind of situations we need to transfuse. Sometimes we have transfused 40, 50 and 90 units of blood for patients, and we've been able to rescue some of these patients. And that's only because donors were willing to donate blood earlier, which we were able to hold in our stock and give out in emergency situations. Even small children can require transfusion. Sometimes it's cancer, sometimes it's other diseases for which, by which they decrease their hemoglobin levels. They will need transfusion. In uncommon instances, the fetus inside the mother's womb uterus can develop anemia, and these are not very common conditions, but we also have the capability of doing intrauterine transfusion for those patients also. So at any point in your life, in utero to the time that you die, anyone can need blood, and so therefore it should become a community service that you do. It should become a civic duty. When we are eligible, we come forward and donate blood.
It should be every single citizen's responsibility to donate for the future.
Correct.
So how do you create this awareness among people, sir, about blood donation?
Yeah, so that has been a challenge, and as we discussed earlier, some of the myths and beliefs which are persisting in communities have persisted for decades. So we are trying to change things which have been in people's common consciousness for a long period of time. So therefore, it is a person-to-person thing. To some extent, media is useful. People flip through and some pop-up comes and you can educate people. But there are 2 or 3 areas where we want to be systematic. One is that in schools and colleges, it will be good if this is at least people become aware that number one, blood is required for human transfusion. It is a therapeutic product. It can only come from human beings. So therefore, people need to donate blood. The second is that we've worked with community, especially over the last 1.5 to 2 years. We are conducting a series of blood donor motivator workshops, and if someone is interested, you can always reach out to me. We do small group discussions where we explain a little science, but it is more about convincing people as to why blood is essential and the social story around it, and how only human beings can donate blood for other human beings. We also get sometimes some of our patients who have had transfusions to come and speak to us, or sometimes it's a parent of a child who's had transfusion who will come and share their experience. And at the end of it, we take them on a tour of the blood center. So at that point, they realize how some of these operations are more complex than just people think collecting blood and keeping it is a simple thing. So we do have complexity in our operations, and we have to run the blood center 24/7. We have staffing for that. Last year we did 120 blood donation camps. So every time a team has to go out, a doctor, nurse, some technicians to go out to collect blood from donors who are willing to do. So we are working closely with the community outside and also within the hospital. And then on important days like World Blood Donor Day, June 14th, which is coming up soon, and then the National Blood Donation Day on 1st of October, which is an Indian important day for blood transfusion services, we see that there is more awareness and more publicity. But we think that this is not enough. A lot more needs to be done, and especially with people who are more media savvy, I think more opportunities should be looked for.
And based on this details, sir, if a person wants to donate blood, whom should he or she contact?
Okay, one is that all blood centers are authorized to collect blood. So you can walk into any blood center and say that I want to donate as a volunteer, and it's easy to volunteer and it's easy to collect blood. We try to facilitate things for our voluntary blood donors and make sure that they get a fast track and a red carpet treatment so that you're not delayed unduly when you come into the blood center, because we'll have other relatives of patients also who come in to donate blood. So volunteer donors can walk into any blood center and donate. There is a national blood site called e-Raktakosh. There is an effort which is ongoing, slowly developing to see whether they can put up information about all the camps near you. So if you put in a pin code, then it will show which are the camps which are being organized close to you. It's starting with the government blood centers, and then it will slowly move out to the
Okay, so
other
it
blood
was safe.
place to go. Anyone wants to organize a blood donation drive, please feel free to contact us. We will be
We
happy to
often
come.
conduct blood donation camps at VITC.
Yes. So it's on my list of groups to be thanked. So VIT is one of our largest supporters in terms of voluntary blood donors. And I think at least 2 or 3 times a year, there are large blood donation camps here. It's a really exciting time. So sometimes we've had our own students to come here and see what happens in VIT so that they can be motivated to
Most welcome, sir.
increase blood donations among themselves. The Red Cross, the NSS, NCC, all of them have supported our venture, and I'm truly grateful to all the student leaders and coordinators and the students who come forward to donate blood constantly. It's a very important resource for us.
So why is O negative is always considered as universal donor, sir?
Yeah.
But they are limited in receiving options.
Yeah. So you remember we talked about A group, B group, and O group. So O group people don't have A antigen and B antigen on their surface. So what people who don't have A antigen will produce anti-B antibodies. It's a way of the body's protection for itself. And people who are B group who don't have A antigen will produce anti-A antibodies. So the O group people without A and B will produce anti-A and anti-B antibodies. So you cannot give A group blood to a O group person. They will have antibodies, and that antibodies will lyse the red cells in the bloodstream itself, and it will become a severe transfusion reaction for the patient. So therefore, O group people can only get from O group. O negative should preferably be receiving blood only from an O negative person.
Okay, sir. So during blood donation camp, especially in rural areas, like you would face many challenges. Like what are they, sir?
So first thing is awareness. Because of lack of awareness, it's not very easy to reach into the grassroots level to penetrate and to get voluntary blood donation camps. So we need more spreading of news through NGOs and other organizations. The second thing is often when we are invited to do a blood donation camp, we go and we do a recce of that place. We have a checklist. We go and look at the place, and we make sure that the organizers know what all need to be done. We should have a place for donors to wait, some confidentiality for screening, for asking the questions without everybody hearing. Then we should be able to have a good place which is well ventilated for collection of blood. Donors should be comfortable at that time, and for post-donation refreshment and relaxation. So we go and check all the places that we collect blood in. For some of these places, because they don't have facilities for this, we take our mobile blood donor van. We are grateful to our sponsors, SBI Vellore Town, which has donated our voluntary blood donor van. So we have 3 couches in that. It's air conditioned, and it's kind of self-contained. We can go park that vehicle somewhere and run the generator, and we can collect blood within that van itself. And so for small camps, when we are less than 25 people, we encourage people to use that facility. So even for small camps, we can conduct camps, and we can collect blood in the mobile service itself.
So thank you, doctor. We are finally at the fag end of our interview session. Thank you so much. It was very interesting, informative. And me personally, I got goosebumps when you said that in utero blood transfusions are happening. As a mother, it's a new data for me. On behalf of VIT Community Radio and VIT Vellore, we thank CMC Vellore and all the other blood donator groups all over the world. A great thanks to you, sir, for your precious time shared with us. Thank you.
Thank you so much for this opportunity, and we look forward to engaging with you all. And there's an open invitation to come and visit our blood center and see what happens over there.
Sure.
Biotech growth should come in.
Yes, sir.
Yeah.
Sure, sir.
Thank you very much for this opportunity, and looking forward to your participation.
Thank you.
Thank you.
Thank you, listeners. You were listening to Dr. Joy John Mamen on the occasion of World Blood Donor Day for the special episode Your Blood, Their Tomorrow. In order to hear for more interesting facts, keep listening to VIT Community Radio 90.8. Until then, it's bye from Dr. Visa, and along with me,
RJ Sai Saranya.
RJ Aarti.
keep listening to 90.8 VIT Community Radio. Thank you.